Let me begin directly a little bit with the agenda of what we're going to do today. Basically, we're going to see some of the results we collected with the surveys about the different breakpoints for the different pollutants. Then we are going to compare them really fast again with what we were able to find out there. And finally, we will see some of the comments, and I'm more than happy to hear your thoughts or any input on a specific matter and a specific pollutant as well. So in general, for PM 2.5, the majority agreed, although, and very welcome, many people, some of you provided also some other limits to consider. Here is what we were able to find among the different instruments that they have developed indexes, or also some country-oriented indexes, the most big that I could find. One of the biggest struggles that I had was with Canada. Although they had a big amount of documents around the index, they didn't disclose the actual numbers that they use for what they are considering low and high concentrations for the different levels. So for this reason it's empty, but I included the colors as reference of what other people are doing in other countries. So as we can see, in general, as a higher concentration for the good is considered between 10 and 15 micrograms per cubic meter. At GO IAQS, we decided to go with 5. Basically, we did exactly what the US EPA did by taking the annual average and converting it into an index. But something that I feel many people didn't understand was the fact that now we are talking about the indoor space, and we want to take advantage of the technology that we have in our hands with real-time data. So the index is not going to update every hour, it's going to update constantly based on the information they're getting from the sensors that different instruments have. For this reason, let me go to the next slide. So lots of people said why we're not looking for 9 to 15 micrograms per cubic meter for the highest concentration in the good tier. Some others say the same thing, like 15 micrograms or 9 again. Professor Powell also recommended using the tail rating scheme, which for the good tier, they have a maximum of 10 micrograms per cubic meter. And there were some other comments that you can see on your screen. Some were saying about including PM2.1, PM1, or ultrafines. But those things, they will come later on. Currently, we are focusing heavily on PM2.5 and nothing else. We do have created a work group for those particles, like the ultrafine and some micron particles, but they will come in a future version of the standard because we are still missing data and information from the scientific community. Some people, they didn't understand the fact about how the index work, so they were talking about the 24-hour TWA value that we can use as a ceiling. If they would like to speak about it more, they are more than welcome. Keep in mind we don't have a lot of time, so please, if you have any comments, keep it short. Albert, please.
Yes, thank you. If I misunderstood, I apologize, but the reason I commented about this is that we were asked in the poll to vote on breakpoints or limits that did not specify a time frame, either an immediate ceiling level or a time-weighted average over any of the time frames that the original standards are based on. With the WHO limits, for example, they range, depending on the pollutant, for 15-minute averages up to 24-hour averages. Typically 1 hour and 8 hour are also specified. But of course, they're all different. And the ceiling limit is usually higher than any of the time-weighted averages because it's an immediate threshold. And my comment for all of these is that coming from the perspective also of manufacturer who wants to build these devices, we need this information to move forward. We can't know when to alert the public, if it is either to be a ceiling warning immediately, which I favor personally, it's more protective, or a longer delay with a time-weighted average and alerting them after the fact. I think our poll needs to distinguish that, and I wonder if anybody else has this concern, if they could comment what they think the proper time frame should be, unless you've already
Let
selected
me
it.
add something on that. So on the proposal limits that we do have for some pollutant thresholds instead of our weighted values. For those pollutants like carbon dioxide, radon, and formaldehyde, it's easier to convert them back to an index, taking this number into consideration as a higher concentration for the good air quality. For the others, it's a bit more complicated, and I heavily relied on what others did before me in order to understand the logic. I tried also to reach out to EPA in order to understand why they took the annual limit and converted it into 1 hour limit. But unfortunately, I didn't have any comments from them. And yes, that was what I experienced, for example. And if someone else has any comments, please raise your hand in order for me to see, and I'm more than happy to hear you.
I didn't understand your answer. Can you please clarify? Are you specifying that all of these limits are to be ceilings, or are they varying? Some are ceilings and some are not ceilings.
Albert, we do have developed limits, and now we are developing the index, two different things. Although for some pollutants, those things, they align because we have set some thresholds for the limits of some pollutants like carbon dioxide. So it's easier to take the 800 parts per million and convert it as the higher concentration of the index for good air quality.
I understand that the index is different from the limits, but the index still has to decide when to tell the user.
The index,
that
as
the
I
air
mentioned
quality
earlier, works in real time. Instruments nowadays give you information in every second. So they take this information and they update the number on the screen.
I understand that, but also instruments in real time are calculating, at least in industrial hygiene, portable air quality instruments, calculate the rolling average for a number of TWAs. 15-minute, 1 hour, and 8 hour are all usually built into the instrument, and if any of these rolling averages calculated in background are exceeded, you get an alarm to alert you, and it tells you by how much what the current 8 hour or 1 hour average is that's been exceeded. So I think any instrument needs to do continuous monitoring, and what's not clear is when you move from the good range to the next level of warning, does that happen instantly as soon as any GO IAQS limit is exceeded?
Yes.
Okay, well, that was not clear to me here, that these are
It
all
was written inside the white paper. I don't know if you had the time to read
it wasn't in the balloting, so I wasn't clear, because many of the ballot tables include standards and refer to them, such as WHO and EPA, that are not ceilings, right? They were established as TWAs. That's my confusion. Thank you for explaining it.
Yeah, absolutely. Anyone else? Any comment? And I would like to bring here another comment we received, and that was coming from a sensor manufacturer, an instrument manufacturer, that they worry that 5 micrograms is too low, specifically for some sensors, that they cannot even go below 1 microgram, for example. And maybe that may create some issues, accuracy issues. Kevin, please. No? Okay. We cannot hear you, Kevin. I don't know if you...
Sorry. Now, I'm audible, right?
Yes.
Yeah. 2 points to comment on. One was the comment by Albert that we need TWAs, which are in most cases pre-built within the instrument or the measuring devices, right? From my experience in some of the field deployments in terms of indoor and outdoor air quality monitoring, these threshold levels or ceilings that we mentioned will be breached in an instantaneous way near the boundaries multiple times. Like for example, let's say in India, we use 15 micrograms per meter cube as PM 2.5 limit for indoor air quality standard based on some of the building codes and building standards. Right now, the sensors will give 15.1, and in the next minute it will go to 14.9, it will go to 15.3 again, go to 14, below 15 once again, right? So we are measuring at every 1 minute, and in case of instantaneous alerts, it might happen that we might get frequent alerts during this boundary conditions. That's one, and therefore slightly a weighted average or a time weighted average is more useful when it comes to alerting the building management or the facility manager. Right. The second point that you mentioned of for the range of 5 micrograms per meter cube, there are from the sensors point of view, specifically low cost sensors which use infrared and laser detections, the range of 5 micrograms may be too low for them to detect these scenarios continuously. The reason being the accuracy itself of the sensors being sometimes plus or minus 3% of the total reading within the 0 to 50 micrograms band, and therefore this might pose a challenge to challenge when it comes to monitoring the environment, which is like 0 to 5 or 0 to 10 micrograms per meter cube.
Thank you. Indeed, and I have seen that in many cases, especially when specific dashboards they have developed in order to alert users about the air quality. And in those cases, what manufacturers do is they roll out alerts, well, you can imagine them as notifications, every 10 minutes instead of second by second or minute by minute, in order to avoid that kind of problem.
Yeah.
Bren?
Yes, thanks. I just wanted to kind of reinforce the importance of making sure we don't perpetuate the misunderstandings or confusions that could take place by presenting a summary of what we're just as Albert's points with seeing the reference standards in the survey. It wasn't clear what was being done relative to adopting those standards and changing units and all and manners of calculation. I think we need to find a way to very clearly convey in marketing, in the briefest kinds of presentations, how that's being done and what it really represents.
Right. Maybe that was a mistake from my side, as I took things granted because we already have this information on the white paper.
Right.
But
You're
maybe
very well ingrained with
yes.
what you intend, right? So
right, yes.
I think the point is that to reinforce that it's really important that we rethink how to present that in a very succinct, brief way and as we move forward.
Thank you. I think Robert has written a message here. Let me see, with a comment. So I think you still need to define the precise logging interval and averaging period for each threshold. Otherwise, a single spot measurement that called and be an outlier or biased measurement will trigger an alert. Well, in general, Robert, when it comes to air quality, we suggest not taking spot measurements because air quality is so dynamic and changes minute by minute. I have actually prepared an article about that, but either way, I think you're right. We have to include this information as well in the explanation. Like we think that we should measure the air quality in a continuous mode, but not by taking like a single spot measurement. Thank you. So I would like now to hear your general opinion about, do you agree if we implement this 0 to 5, 6 to 15, and 16 to 100 or more micrograms per cubic meter for the 3 levels we have already established? Or is anyone here opponent to that for any reason? I would like to hear them explaining a little bit more their position. Albert?
Thank you. My concern is this ongoing contrast between what would be the green or the good level, where we're talking about presumably a continuous long-term exposure, then sometimes exceeded by the higher breakpoints, right? Or sometimes exceeded past the first breakpoint and then on to even higher ones, which presumably require a more urgent alert. But all of these breakpoints come from standards or guidelines that were originally published or traced back to original publications of guidelines and standards that were all using the same time-weighted average, whether it was 1 hour or 8 hours or 24, and they didn't treat these exceedances as ceilings. And I like that we're imposing a much more stringent level of early warning by doing this. I'm concerned about confusing the public, offensive, with this difference, though, between no longer treating them as averages, but now treating them as immediate warning. And I want to suggest an easy way to perhaps communicate this to the public, which is to acknowledge these are set originally as time-weighted averages over a very long time, and to be most protective, following the precautionary principle, we are choosing to alert you the moment this average is exceeded. So,
I think I've seen only the averaging on instruments, when I talk about instruments, only on carbon monoxide sensors or monitors, but I've never seen it when we talk about PM2.5. Most of the instruments, and believe me, I have used many of them, they just update the information constantly as they get the reading inside.
I'm not commenting on the instruments. I'm commenting on the actual original standards and regulations. I realize there's a lot of instruments out there that are not faithfully following what the standards require, and I'm trying to get us to a place that's clear. If we're not going to follow the standard, that's okay. I think we should just explain it in a way that's understandable to people who are aware of the standard.
Yeah. Okay. Yeah. Fair enough. Okay. Anyone else? Anyone has anything else to say about specifically the numbers? Like those people that they suggested 9 or 15 or even the pale breakpoints. If they would like to say something, I'm more than happy to hear. And regarding the comment Kevin said earlier, in places like India, Bangladesh, and other places where air pollution is very high, it's very difficult indeed to achieve those 0 to 5 micrograms in order to be good. But I mean, this is the end point, to help people breathe good air at the end of the day, and this is the limit that they should, in order to protect themselves. I'm more than happy to change that. It's not like I'm Yuki. Okay, Florian, please.
Hi. Yeah, maybe just a quick comment from my side. So I'm not sure whether it might make sense to actually put an intermediate category in there, because if you have a very low limit and you trigger it very often, people might just not, take care about it anymore. Mm-hmm. If you're constantly over the limit, you just say, yeah, that's always red, so I don't care anymore. So if you don't really have a measure to actually get to that point, and you have, let's say, a very low time average, then you might just, then you have a standard, and the people could just be like, yeah, we're never going to reach that. So I was thinking maybe is it a good idea to have like a very good and a good distinguishment to kind of, let's say, also acknowledge that you might not always be in the 0 to 5 regime, but in the end, 5 to 15 is still better than not doing anything about air quality, right?
Right. It depends on who you're talking about. Like, I have conversations with people from America, for example, or from Europe, and they say it's super easy for us to achieve those because we have the means, like the filtration, good filtration on ventilation systems and all of those things. So in most cases, they try to achieve those numbers. And then you have people from other places where, unfortunately, for socioeconomical reasons or for any other reasons, they are not able to achieve those numbers indoors. And even if they had those filtration systems in place, because their environment is totally different from North Europe, because they have windows all the time open. They will never achieve those numbers. And what are you saying to those people? Close windows and filtrate everything in order to achieve that number? So maybe you are right. Like 5 is too strict for everyone to follow. And
it's a global standard. I mean, Europe
yes.
and, US is like one region, but if we talk about a global standard, then at least it should be somehow reflect what's achievable, I guess, on a global scale. I mean, I'm from Europe as well, so I agree, like 0 to 5 should be achievable here, but I'm not sure if this is applicable for all over the world.
Thank you.
If I can just add a comment, Florian, are you aware of the WHO 2021 standard guidelines that actually I think have 3 or even 4 bans depending where your country is starting from? So to avoid this problem, they let countries where air pollution is already worse outdoors and can't be better indoors to have a considerably less protective series of the top, middle, and lower band, and encourage countries to move up through that 4-tier layers towards the goal of the best air quality. But that gives each country a range within which they can have a good zone, even if they're not the best.
Yeah, but now we are confusing a little bit about average limits over a year with an index, right? And we do have two tiers inside GO IAQS as well. We have the starter and ultimate for this reason. But now when it comes to communication, should we be as strict as well, or be more flexible when it comes to those limits, those breakpoints that's going to help people understand on whether they are safe or not from air pollution, in particular PM2.5?
Yeah, I mean, I'm aware of that, and I think that's not the point. I'm just voting for something like if you want to go for strict, then I would actually increase the number of categories. If you want to have, say, like we want to have a very simple system with 3 categories, I would rather vote for not being too strict to actually, make these categories also have a value for all over the world, that people can actually take measures to achieve that. If you can't really take any measures anymore to achieve that, or just very, very expensive measures, then, you might lose the motivation actually to do something about it.
Thank you. Dima?
Thank you. As the table that you're showing presents, there are quite a few different targets that one can look at when trying to optimize ventilation and purification in a particular space. So providing this variety to the end user might be a solution similar to the ones that you mentioned with different target levels in the WHO standard. So if a particular user has means and tools to achieve 0 to 5 levels of particulate pollution, that's okay. You cannot really link directly the levels to health effects, because they are specific to they're different to different people depending on how susceptible they are, and also different depending on the nature of particulate pollution that they're facing. So as a representative of a company that is providing software for users in different parts of the world, we try to provide choice to our users of different levels, whether aligned to national standards, to global standards, and we are going to make GO IAQS as one of the options now. Thank you.
Thank you. The problem is, and we are a bit over time with PM2.5, is that why should people be treated differently because they were born in an unfortunate country where air pollution is very high there, and they should follow their standards where are less flexible or less strict from other standards around the globe? That's the main point we're trying to address with one index. have everyone under the same umbrella and same protection. Whether they can achieve it or not, like now this is not up to us, it's up to them to do their best in order to improve indoor air quality. Okay, unless someone else has anything else to say about the limits, I would like to continue with carbon dioxide. Again, majority agreed with the proposed limits. We also had some other suggestions. This is what we found from different companies out there and some standards that we could have our hands on, like the tail and the European one, EN 13779. Again, 800 is like the predominant number as the higher concentration for carbon dioxide. And then we have the second tier between 1400 and 1500, and then from there up. Unfortunately, some of the standards, they didn't have colors. Indexes, they didn't have colors. So this is the reason some of them, they don't have colors, because they just had some tiers but no colors. And some of the comments we received, apart from some other suggestions, where some people suggested going even stricter for the good air quality, with 600 being the upper limit for the good indoor air quality. Suggesting continue with following the tail paper, and then there was lots of debates. Actually, CO2 received most of the comments, and some of the comments were saying that carbon dioxide is only there for pathogen transmissions and nothing else, which is okay. Like, we have accepted that, I think, for the majority of the people. But the fact that when CO2 is there, maybe other pollutants will be there. This is also something that we have to take into consideration, and like other VOCs and other gases, I mean. And any other comments that stuck out? Yes, and for example, Belgium had already established 800 parts per million when they are considering people with some immunocompromised problems. But then for the rest of the population, they are considering something like 900 parts per million, which is very interesting as well. Okay, I see hand. Bren?
I just wanted to say I don't agree that the only point of tracking CO2 is for pathogen reduction. It has a profound effect on the way respiration works in the body. So.
Fair enough. I mean, the person that said that cited ASTRA's announcement, where they said that carbon dioxide does not mean anything apart from what I've just mentioned. And now, in reality, like I've mentioned, I think that when we have CO2, high CO2 levels, we also have other pollutants concentrated in the indoor space. So my main question is, everyone agrees or has any opponent regarding the limits that we have established, like 400 to 800, 800 to 140, 1,400, and 1,400 to 5,000. Albert?
Just to be clear, you're proposing then that if the orange or red level is entered, there should be an immediate warning to the users. If they're using a GO IAQS index, they would get an immediate warning each time the CO2 was in this range? Or would the total index of all the pollutants together still have to exceed some threshold to provide a general warning?
Well, we have developed a system where when we are talking about multiple pollutants, everything is calculated based on the different concentrations. But now if we have an instrument that solely measures CO2, then they only have to calculate that particular gas.
Okay, so to be clear, if any of the pollutants we're talking about today that are going to have some breakpoint, if they exceed that, there will be an instant warning.
Yeah. Yes. You've muted your microphone, Albert, but yes.
I'm sorry. I'll say one more thing. I am concerned about the bounce that somebody else has mentioned. There's a lot of background bounce in these numbers, and it might be helpful to specify a brief ceiling exceedance requirement, such as even 1 minute or 5 minutes in that range before you trip that warning, because if it went away within 5 minutes as a toxicologist, I would say that was not an exposure that required a warning.
Right. For carbon dioxide, yes, it's not going to kill you if it surpasses a certain limit for a short period of time. And this is another comment we received actually. We're saying it is about how much time you are spending exposed to carbon dioxide for a virus transmission, etc. Lula?
Hi, I was just trying to, I had a first question. The first column, the greenish column, was it good or was it like the best?
Right. Everything. So the language behind different levels is very complicated among the different indexes here. So if you remember well, everything begins with good.
Yes.
And end up in extremely severe, and everything in between.
Yeah, that's what I thought. Then I was because so in Belgium we do have we have maintained the 900 ppm, so the outside temperature, outside CO2 plus 500 ppm for quite some time, which it's written in multiple laws, so we won't be able to diminish it to 800 ppm, definitely not. So that will be I said for us, so we couldn't easily adapt this index in general. So I have two questions. One, is it we do adapt the 800 ppm if there is an infection risk,
right?
But that's when there are peaks of influenza, of all these very seasonal epidemics or pandemic. And in general, it's 900 ppm. And I was wondering if that's something. Is it in a general sense that the CO2 is max 800, or is it also taking account these epidemics?
No, we haven't created this differentiated point on between if we're talking about a viral outbreak or not. It is 800 in all cases for everyone. And we did receive many messages from our members saying that we should drop that number even lower to 600 parts per million.
Okay, well,
in order to address that specific problem.
Oh, okay. And then my second question is, could it be possible to take most of the eco index, but also make some changes when implementing or when using it? Do you think that's something you provision in the future? So like I said, in our legislation, 900 ppm is written in multiple texts. It's if we want to take this global indoor air quality standard, it's impossible. It's very difficult to take the CO2 at 800 ppm.
I mean, if
we can then take the rest or make an adjustments.
I mean, we are not going to find you just because you've changed the numbers. You're more than welcome to take any research or thought that we have put behind. So if the colors align with what Belgium believes, they're more than happy to take them and adapt the numbers. This is what we are recommending based on the research and the team that we have. For example, the 800 parts per million comes directly from Lydia Smarowska paper. So we are trying to align with that, but we cannot enforce everyone that they have to follow exactly that. This is not up to us, and especially a government. We would like to influence, for sure, but we cannot enforce anything.
No, yes. I was just thinking of maybe possibility that the rest of the calculation would be off or something. But okay, perfect. Thank you.
Thank you. But you gave me a great idea. Like maybe we should think about creating this duo, like, are we talking about the epidemic or pandemic situation where we have to be strict, so then we update or we use a different slight version of the CO2 index in order to accommodate those situations, or we are keeping it as it is, like for everyone all of the time, 400 to 800 and so on. Okay, unless someone else has any comments, I would like to continue with carbon monoxide.
Can you go back to carbon dioxide for just a second?
Yes.
On the high end of the GO IAQS, you top out at 5,000, and that's the OSHA limit for workers in an 8-hour workday.
This is the limit for one reason, because most sensors out there, they cap on 5,000, sorry.
Again, I don't think we should be setting standards based on technical limits of the sensor makers and device makers, because they could be propelled forward. We know that other sensors exist. They just chose not to use them. You can get CO2 sensors up to much higher ranges and dual ranges and so on. I'm more concerned in raising this just simply in the context of occupational limits. And in Europe, the occupational limits are lower, but they're still higher than these indoor air limits. And I wonder if the GO IAQS is going to specifically say somewhere that these are not meant to be occupational limits or used in workplaces.
Yes, we do have it already inside the white paper.
Okay.
We state that we are not related to occupational health.
Okay.
Robert has another comment. The limit of 5,000 years parts per million CO2 is not recommended for occupied rooms, according to the ISO 16000. And I see some other comments from Robert. Parts of the issue is that there are some pollutants have an immediate short-term effect on health, like nitrogen dioxide and ozone, whilst PM2.5 tend to have a more long-term effect, as measured by DALIs, etc. Therefore, immediate value could perhaps be higher in the short term for PM2.5, compared to a pollutant which might trigger an immediate health effect, asthma attack, etc. Great comment for that. And another comment, I appreciate the general sentiment here. The practical implementation for filtration system in more polluted countries, while have pronounced effects on the choice of filter quality, replacement rates and system performance. If they want to try to achieve A grade air quality, example comparable with Norway or Greenland, etc., this could make the standard unattainable. In particular terms, it may, in many countries which most need to implement them, this could lead to frustrating and ignoring the device. Thank you for that as well. Just copy and paste the information. Okay, let's move on with carbon monoxide. So again, great agreement again. We did have some other recommendations, and this is what we found regarding indexes out there when it comes to carbon monoxide. And let's see some of the comments and recommendations for other numbers. So some people recommended 3.49 parts per million for the upper limit. Some other recommended 3, and in some other cases, they were considering like 5, the same that we have. Some other comments say that 5 parts per million is too high. Some other comments say that carbon monoxide should be good or bad, so you don't have, in between. I understand that comment, but again, it depends on how much time you are exposed again, and what you are trying to communicate back. Some people recommending another standard from the British standards. Now the European work safety limit is 20 parts per million. Again, we are not accommodate occupational limits. Levels above 3 parts per million indicate some kind of anomaly. Low levels of carbon monoxide is not well recognized in the long-term negative health impact At 9 parts per million, some pregnant will certainly time of period exposure could have a miscarriage. GO IAQS should recognize that 0 is not better than a stable low baseline. I would like to hear more about this comment from the person that wrote it, if they are here. And finally, choosing globally appropriate number for carbon monoxide is challenging because, first, carbon monoxide exposure risk relates in parts of extent of exorcism from the baseline levels, and it matters how stable those are. Response of carbon monoxide exposure to hermetic, and carbon monoxide exposure is influenced by endogenous production. Well, we know about that. Any comments? Albert, this is your expertise.
Thank you. I hope others will have comments as well. The main comment I've made many times now, I'm really disappointed it didn't come through to this slide, is that there is an abundance, over 100 environmental epidemiology time series studies done around the world, including multi-country studies with over millions of people in them, that have identified death, same-day mortality increases, not dailies over weeks, months, and years, but same-day mortality increases in carbon monoxide related deaths that are increasing with just 1 ppm or less of a background over usually 8 hours. In some studies, just 2 ppm over 1 hour, also increasing all-cause mortality. And when compared by interquartile range increases, which is how we can compare different pollutants in the same studies, CO and NO2 usually have the highest impact on same-day mortality, more than particulate matter. So I think we have to acknowledge that there are no studies that show exposure to CO at 3, 4, and 5 parts per million is good, safe, or healthy. Those are levels that increase same-day mortality, and that's a really serious outcome. The second point I want to make about this, though, is the issue of treating these as an instant alarm. And it is helpful to warn an occupant of a building when CO starts to go up as soon as it does, so they could look for it. But I do recommend, even with CO, some brief averaging time to be sure this is not a transient spike that will be gone in a minute or two, and to make that instant threshold a reasonable distance from the acceptable range of 0 to 1. I think a 5 ppm threshold is actually a reasonable place to alert somebody, but I don't think it's safe to tell them that 2, 3, and 4 are safe or over a long term, because over 8 hours, that increases mortality. Thanks.
Thank you. Bren?
Yes, I was the one who made the comment about the 0 is not necessarily better
Okay.
than a stable low. So I agree with what Albert just said, and also that there is plenty of evidence that a low level of CO has a hormetic beneficial response in preparing the body to be able to have more resilience. So I think we need to be careful about saying 0 is optimal.
Thank you. And we also have another comment from Professor Robert. I agree. This is exactly why we need to consider the immediate as long-term medical effects of specific pollutants when setting short-term limit values. So 5, from what I understood, it's not like the appropriate number. Sharon, you have a comment?
I agree with Albert's comments. And also, if you could go back to the previous slide where you talked about detectors, I thought I saw something on there about the optimal solution is a combo smoke and CO alarm.
You mean here in this slide?
By CO detectors connected to smoke detectors. Can you explain what that means?
Okay, best handled by CO detectors connected to smoke detector. That comment came from Professor Powell, if I remember well. I don't know if he's still on a call with us and if he would like to add a little bit more about it. Professor Powell. I think I mispronounced his name, Professor Pavel. If you would like to comment on, because I think these comments come from you, if I remember well. Correct me if I'm wrong.
Well, if I can jump in, I think he is referring to the combination type sold in the U.S. and in Europe of a CO alarm of some type combined with a smoke detector of some type. The problem, with or without a digital display, is that these devices do not give any warning at all below a very high threshold of 70 in the U.S. and 50 in Europe, and we all would agree that's too high. And they also have a time delay built in that we think is not acceptable because everything in the index is based on an immediate warning as soon as the green good level is exceeded. And I urge us to stick with that. To be consistent, we should be thinking about what is the CO level we need to instantly warn people at. And I think that's much lower than in a CO alarm. Thanks.
Indeed, there are two types of instruments out there. We have the alarms that they do exactly what Albert described now. And then we have monitors where they will measure and display this kind of information to the users for, I don't know how often they are designed to take measurements, every second, every minute, or every 10 minutes, I don't know. And they are two different things in reality, right? Like one is regulated, alarms are regulated to have those specific limits inside, but monitors are not regulated. They can have their own index. Now, when we talk about an index, it is meant for a monitor, not an alarm. An alarm is going to use a threshold, if you like the way Albert described it. Does that answer your question, Sharon?
Not exactly. My question specifically is, why are we saying best handled by CO detectors connected to smoke detectors? To me, I'm not understanding how connecting a CO detector to a smoke detector is best practice.
I don't have the answer to that, but we can follow up with the person that wrote that, and I can let you know about the reply.
Okay, that's fine. My concern is that we've seen historically that CO detection is assumed to be part of a combo, and it's not. So people get confused by these combo alarms, and so even to the point where building inspectors are confused by them. So there has been a lot of talk about being separate CO alarms and smoke alarms. So I was late to the conversation. I wanted to try and understand that a little bit better. That's all.
I see. Thank you. So what I gathered a little bit from our conversation today regarding carbon monoxide is that we should consider the long-term effects of this specific pollutant instead, and the long-short effects, like the immediate, and we should lower the upper limit for carbon monoxide. Am I right?
Is it possible to propose a limit for this, as Belgium has done for CO2, that would say there's some level X above outdoor ambient background? Because there is always, in different countries, some outdoor ambient CO, and that's what people there are habituated to. In Nigeria, it's about 10 parts per million everywhere. In America, it's less than half of 1 part per million. And people who live with 10 are not bothered by 2, 3, 4, 5, 6, 7, 8, and 9 because they literally do not absorb that from their lungs into their bloodstream when their blood has already got 10.
So maybe we should have a delta, like saying based on your outdoor levels, should be the indoor level.
I would like that for companies that, as with, for instance, thermometers now, can sell you a thermometer that has a lead that goes outside and one that's inside, and just looking at the thermometer shows you both temperatures and the delta, and can even control your HVAC accordingly. But if we could do that in some way with some of these air pollutants that we know have a background level that you can't get lower in your house just because that's already there outdoors, right? CO is not filterable, or at least not at reasonable cost. So anyway, I just put that out there as a way to improve what we're communicating and adjust for different country backgrounds that can be, as I said, from less than 1 to more than 10.
That's great feedback. Thank you.
And that takes care of recognizing also that there is some benefit to having that steady lower background. Thank you.
Thank you. Lula?
I do understand that this is scientifically more correct, but I do have to make the sideline that from a legal and enforcing perspective, this is way harder to incorporate, it's just a choice, but if you want to have functional, enforceable legislation, this is a very hard thing to do.
And then also it comes to, let's say that this index is implemented in instruments out there. How do they know what's the outdoor, let's say, concentrations of carbon monoxide in order to do the delta working properly? It's a bit tricky. Because even in the same country, it can be higher and low depending on the altitude that the person lives, right?
Even in the same city at the same time, just depending how close you are to highways. I didn't have an answer. I just proposed it.
Okay. No, it's fine. Thank you. Okay, perfect. We only have 7 minutes, so I'm gonna try to talk about a little bit about formaldehyde. Great agreement around the limit that we are proposing, which are basically 0 to 50, and 51 to 100, and 101 to 500. Some companies out there, they're using occupational safety thresholds. As you can see, this is the reason they are high. Some people asked, why are they so different? And some others, they don't. They use some numbers from some other standards that they have developed. And some of the comments we received were recommended max breakpoint for formaldehyde for the good level at 8 parts per billion. And this is what they're proposing, 0 to 8 parts per billion, 8.1 to 100 parts per billion, and 101 to 500. Another comment was about using, again, tail scheme, and the dangerous effect of gases are not easily perceived as after long term. So when diseases appear, it's quite serious. So basically, they're saying that we should always have a lower number in order to protect and avoid these long-term exposures to higher concentrations. I think for formaldehyde, it's a little bit easier to consider the 50 parts per billion based on what we saw from the standard, which I don't remember now the name, but I need to find it. Give me a moment. So index breakpoints. And I will tell you where it comes from exactly. Yeah, it's coming from the Building Biology Institute, and a standard they developed in 2015. And this is the reason we propose the same numbers. Hopefully you all agree to keep it as it is, or we can even lower the value. If I remember well, for formaldehyde, we have a specific limit set on the ultimate version as 27 parts per billion. So we can shoot for that as well in order to align the numbers. Any comments here, Albert?
Yeah, biology is not a credible independent source, I think, because they sell their training and they are not a regulatory body. I urge you to go back to the slide and look at the California limit in the notes that someone put a comment in. The California Office of Environmental Health Hazard Assessment has a chronic reference exposure level, which essentially means the green level. It is 9 micrograms, about 7.3 parts per billion. That's meant to be 24/7. Like you live in a mobile home with a formaldehyde problem. If it's up to 7, they're saying that's good and green, but anything above that, we could no longer allow that as a 24/7 exposure. And I think that's what this GO AQS green level means in your index. This is a green zone for 24/7 exposure. And if you have a credible authority like California saying that that shouldn't be higher than 7, I urge you to go with that. It's much better recognized than biology.
Thank you. Bren?
Yes, I concur, and that's why I recommended that keeping the good category at 8, whether it's 7, 8, 9, somewhere in there. I wasn't suggesting changing the other breakpoint between the yellow breakpoint, the upper end of that, but just shifting so that what we're saying is good is 24/7. And I have to just full disclosure, I happen to be one of those people that just don't process formaldehyde very well, and so yes.
Thank you. So excellent. We only have 2 minutes, and the meeting is gonna over. We do have some other pollutants that we have to discuss, so we will have to arrange another time for that. Unfortunately, I don't want to take more of your time. I also have other things arranged as well. So right now I'm going to take all of this information again, recopilate it, inform you publicly of what we have discussed, and we are going to also arrange another call to discuss the rest of the pollutants, which is ozone, nitrogen dioxide, and radon. If someone else has any comment, I'm more than happy to answer it now. Otherwise, thank you again so much for your time today, for all your comments, all your support, and answering the surveys. They are really important in order for us to save the future. And the last news, we are arranging a United Nations event inside the headquarters for this September with us, GO IAQS, the Brown University, the Australian Academy of Society of Science, and some other organizations, including ASRAE. So big things are coming for GO IAQS and for indoor air quality in general. So thank you so much for your support.
Thank you, Sotirios.
Thank you.
Thank you.
Thank you.
Thank you. Thanks,
Thank you.